Well, good afternoon, Build Up dietitians. It's a real pleasure to be here to have the opportunity to talk to you today about the spread of COVID misinformation about so many different topics. My name is Timothy Caulfield. I'm a Canada Research Chair in Health Law and Policy from the University of Alberta. I'm an author, and I have spent decades studying the spread of misinformation, particularly in health, but really in a lot of other domains. And what I want to talk about today is I want to talk about how we can fight misinformation as individuals, as professionals, as a community, because it really has never been so important. So, I hope you enjoy this. What we're going to do is we're going to go through and talk a little bit about what the science says about the spread of misinformation, and then also look at the strategies that we can use, what the science says about those strategies. So, looking forward to this half hour. Please do send in your questions and comments, which we'll get to if I can figure it out at the end of my brief presentation. But I do want to start by talking about how bad it has gotten. As I said, I've been studying the spread of misinformation for decades. I have 2 research grants right now studying misinformation in the context of COVID-19, and even I did not anticipate exactly how bad it would get. And particularly in the area of health and things that are relevant to dietitians, things like immune boosting. So look, there's misinformation out there about the source. You've heard all this stuff, you guys, bioweapons, nonsense, the 5G technology myth, the idea that, somehow 5G technology is having an impact. You have misinformation, of course, about cures. There was crazy stuff early on about bleach. You had things like the idea that you could drink alcohol or snort cocaine. And then, of course, there's also things like the idea that you could drink cow urine. And then we move on to the things that are more sort of seemingly plausible, like the hydroxychloroquine debacle that I'll come back to in a bit. So all this misinformation is out there. There has been this broad embrace of conspiracy theories. The 5G is just a good example of them. The role of big pharma in the spread of misinformation. What's incredible to me, though, is that people believe this. It may sound like nonsense, but you look at the surveys that are emerging. In Canada, for example, my own home country, you see numbers like this: 50%. This is a study from Carleton. About 50% of Canadians believe at least one of the bizarre conspiracy theories. Very similar numbers in the United States. Many believe the bioweapon one, and look at this number: 28%. 28% of Americans believe the extreme conspiracy theory that Bill Gates started this so he could vaccinate individuals to put microchips in us so we could follow us. I mean, that's a pretty extreme conspiracy theory. And again, 28% of Americans, believe that to some degree. So much misinformation out there, and it's having a real impact, which I'll come to in a minute. People off now. So where does this misinformation come from? Well, no surprise, it comes from everywhere. We're studying its formation in the news media. We're looking at it on social media, and we're looking at it on search engines. And really, this is not entirely, but to a large degree, a social media phenomenon. There was a recent study that came out just weeks ago that found that Facebook was one of the primary sources of misinformation, but it's also coming from Twitter. It's also coming from Instagram. It's WhatsApp, TikTok. It's absolutely everywhere on social media. And one of the interesting things, there's a study from Oxford that found that the 20%. In this study, what they did is they looked at debunked ideas that were out there in pop culture, right? And what they found is about 20% of them came from prominent individuals. They were the source. So you're talking celebrities, politicians, sports figures, about 20% of them. But look at this number: 69% of what's spread on social media comes from those sources. So in other words, what's happening is individuals are spreading the misinformation themselves on social media. So in some respects, that can be a good news story. It means it's a bottom-up phenomenon, and that means if we can just get people to stop spreading, we might be able to have an impact. So I'll come back to that. So really, there's misinformation coming from all of these different sources. One of the ones I think is interesting for dietitians, and one that we're studying, is the more subtle ones. You have the hardcore bits of misinformation, the ridiculous ones, like the Bill Gates one, that's absurd, like the 5G one, not even scientifically plausible. But get these ones that are more intuitively appealing. And in your world, for sure, I think it's things like immune boosting. Holy cow, has the idea of immune boosting taken off as a result of the COVID-19 crisis? No surprise, obviously everyone's concerned about and thinking about immunity. But this is a real problem, and I want to touch on it in a little bit of detail. This is actually an area that we're studying, and I do think it's relevant to you guys. People are pushing the idea of immune boosting to sell a whole bunch of different products. Now, first of all, the concept of immune boosting isn't even really scientifically accurate, as you guys know. I know you guys know this, but a lot of people don't realize that. You can't really boost your immune system. Yes, you want a healthy immune system. Yes, you want one that's working well, but with the marketing out there, and we've seen this, we've studied this, is really the idea that you can give yourself extra protection, whether it's through supplements, superfoods, elixirs, essential oils, you name it. All of these different kinds of ideas are being marketed as a way to boost your immune system. And one of the reasons this is really challenging from a regulatory perspective is often they're using kind of wiggly words that don't trigger, for example, a social media platform to flag it as inaccurate. It doesn't necessarily trigger a regulator. There are these wiggly words that get through that sort of get through our regulatory guards, but I also think through the social media platform strategies that are emerging. For example, right now we're studying immune boosting on search engines. So basically, what we did is we pretended that we were people searching for the concept of immune boosting, and we looked at over 200 websites. And what we found, look at these numbers. And by the way, this is preprint. I want to make sure I don't want to hype our own research. This is preprints out for peer review right now. But what we found was 86% of the websites we looked at, over 200, that touched on immune boosting, they represented it inaccurately, and they represented it as if it was efficacious, as if it could help with battling the COVID-19, which, as you guys know, no evidence to support that. And also, the other number I want to highlight is 10%. Only 10% of the websites had any kind of critical appraisal of immune boosting. And we didn't even look at whether that was done sort of scientifically accurately. We were just seeing, was there any kind of critique of the idea of immune boosting? So you got that 86% saying, pushing some kind of idea of immune boosting as being efficacious. And only 10% of the websites that we've looked at had any kind of critical appraisal. So I think that really highlights, how problematic this noise can really be. Okay, so those are sources of misinformation. Another source of misinformation is what's been called super spreaders. We have super spreaders for the virus, but we also have super spreaders for misinformation. There was an interesting study done by the entity called Newsguard. Some of you guys might be familiar with this. This is an organization that does try to fight misinformation. And what they did is they try to get a sense of where misinformation is coming from. And it's coming from the sources that I've talked about already. But it also comes from these super spreaders. And these are often individuals that have a particular ideological idea they're trying to get across, or they're trying to market stuff. Let me give you one example, another number. 2,400,000. 2,400,000. What's that number? That's the number of likes Rush Limbaugh got for a conspiracy theory about COVID. Basically, it's kind of a hoax. It's being exaggerated. Rush Limbaugh, a super spreader of misinformation, 2,400,000 likes for his misinformation. So, that is also another source that we need to tackle. We need to find out exactly these individuals that are spreading it and do what we can. And that's good news from a regulatory perspective, because we can kind of target those super spreaders, right? So we have the bottom-up force of individuals, people out there just spreading the misinformation. And then we have that top down, we have these super spreaders. And so we know if we're going to try to fight this battle, right, we know the two kinds of entities, and there's more obviously that we want to go after. So we have the misinformation out there. You guys know that. It's incredible. It's being spread in a variety of ways, social media, celebrities, prominent individuals, super spreaders. So what's the harm? What's the harm? And people often ask that, they go, this is problematic, but is it really damaging? And of course, the answer is yes. Misinformation has led to deaths. It's led to people being harmed and poisoned. It's led to financial loss. Really interesting research has talked about how this misinformation has increased stigma, discrimination. It's also led to harm in the context of health and science policy. And I think this is often overlooked. The hydroxychloroquine debacle is just one example of that. I mean, you think of the amount of resources that were put towards that topic as a result of really what was, hype in a degree of misinformation. There's a really interesting study that was published in JAMA, very straightforward, but I like this kind of stuff, where they mapped people's internet searches on hydroxychloroquine in sort of correlating it with comments from Elon Musk and Donald Trump. And no surprise, you guys know this, all of the internet searches spiked. And then look at this number, 2,000%. 2,000%. What's that number? That is the increase in prescriptions for hydroxychloroquine as a result of this hype. And as you know, the research that's coming out on hydroxychloroquine is suggesting it's probably not effective. It has certain harms associated with it. They're starting to get a body of evidence emerge around it. And still, we see 2,000% increase in prescriptions, which is really worrisome, right? Because that's not just people being interested in this. That's not just internet searches. That is actual clinical action as a result, one could argue, of misinformation. Okay, so the other harm out there, one of the ones I often highlight all the time, not just in the context of COVID-19, but in general, one of my big themes in the work I do is that I think misinformation just adds to this chaotic information environment. And you guys see this. You see this out there with your patients and your clients. When there's all this misinformation bombarding individuals, it becomes much more difficult to tease the real stuff, the real science, right, from the noise. And there's a recent research that has highlighted exactly that. When you have all this chaotic information out there coming from everywhere, people are more likely to be confused, no surprise, but they're also more likely to believe misinformation. And that's, I think, because of the chaotic environment, but also they can't tease what's real and what's not real. Okay, other harms, and this is one we could do a whole presentation on, and that is the impact on things like vaccines, right? On preventative strategies. Whether you're talking about masks, whether you're talking about physical distancing, and whether you're talking about vaccines. And there's evidence emerging that misinformation has an adverse impact on all those things. Again, no surprise, right? But the data is, let's talk about vaccines. The data is pretty grim. Look, there's a lot of surveys being done all over the world, and it's hard to do a good survey on this from a methodological perspective because people are kind of projecting into the future. What if there is a vaccine, how's it going to be rolled out, right? But despite that, you look at the numbers, they're pretty grim, right? They're pretty grim. So some of the numbers for the United States, look at this one. I'm going to put up this one, half. And I'm going to say only half. Only half of Americans are saying that they will get the vaccine. Now you layer on top of that other, the usual vaccination hesitancy thing, convenience, access, fear of needles, all of those things increase the likelihood of hesitant behavior. So those numbers are pretty grim. I think what you'd like to see right now is a lot of people being very enthusiastic about the vaccine. Other studies from the US have found anywhere from 20 to 30% of people saying they're not going to get it or they think they won't get it. So that's grim numbers. And in my home country of Canada, we're seeing, fairly similar kind of data, right? That people are being a little bit hesitant about vaccines. Grim. Now we have to be careful. Correlation isn't causation, but I think there's no doubt that all the misinformation that's circulating out there, not just about vaccines, but about COVID-19 more broadly, is influencing those less than ideal vaccine numbers I just talked about. Okay, so we have all this misinformation out there. No doubt about that. We also know that this misinformation comes from various sources, and there's a growing body of evidence about the real harm that COVID-19 misinformation can do. Okay, so what can we do about it? What can we do about it? Well, first of all, we definitely need a stronger regulatory response. And we're seeing that. We're seeing that from the FTC. We're seeing that from the FDA. So that's good news. Now, they have limited resources. There's only so much they can do. But they're taking this very seriously, and they are acting. That's good, but we need more of it. And we need people like you. We need people like you to encourage this. So complain when you see something inaccurate about immune boosting. Complain when you see a supplement that isn't being marketed appropriately. Complain when you see a healthcare provider, and I know that's not always easy, pushing misinformation. We need to all act together to get the regulatory bodies to move. We also, of course, need the social media platforms to act, and we're starting to see that also. That's also good news, I think. Facebook, Instagram, Twitter. They're all taking actions, whether it's redirects, whether they're banning certain kinds of websites, whether they're actually even putting direct warnings on certain posts. That's all good. It is a very complex. It's a complex from a health policy perspective, from a legal perspective. I'm a big believer in free speech, so this isn't an easy question. Got to remember what we're asking these platforms to do. We're asking private actors to unilaterally decide what we're going to see, right? So I'm glad they're taking these actions, but this is a broader conversation I think that we need to have in liberal democracies, how we're going to monitor this posting. But of course, the other thing that we need, and this is really what I'm passionate about, and when I want to end with my brief conversation, is we all need to act. We all need to counter. So we need to counter misinformation when we see it, especially professionals like you, dietitians, people that you guys are individuals that people trust. So the next number I want, my last number is 9. 9. I'm gonna outline 9 things that I think a good counter message has. How can we counter a misinformation? I want to start by saying that debunking works, and maybe we can get to this in the question and answer, because you also hear about this backfire effect and the idea that debunking just amplifies misinformation. Those are concerns that we need to watch, but they're largely overstated if you look at the more recent empirical evidence. I think a true backfire effect is relatively rare and very context specific. So I think that we shouldn't shy away from debunking. Okay, so what the 9 things that we need to consider. Number 1, these are obvious, you guys, but let's state them anyway. Number 1, we need good science. There's interesting research that shows, a big study that came out last summer, that if you use good science to debunk something can have an impact. Especially if, number 2, it's presented in a clear way, in a way that's shareable on social media, right? Think about, I always try to think, how's this debunk going to look on Instagram? How's this debunk going to look on Twitter? The other thing that we need is to turn to trusted sources. Yes, I know that's hard now because there aren't that many trusted sources, especially if you're an American. No offense, but Americans are not that trusting of entities like the World Health Organization, the CDC, for some people will say for understandable reasons. But we still want to point people to those trusted voices, those voices that are aggregating the science in a responsible manner. We also need number 4. Now, number 4 is interesting. There's research that comes from the vaccine world that if you highlight a scientific consensus, you're more likely to change people's minds, right? So as scientific consensus emerge, point people into that direction. Okay, number 5. Be nice. Be nice. I sometimes fail on this. It's hard not to be snarky, especially when it's coming from Tom Brady or Gwyneth Paltrow. But in general, aggressive language is not viewed as being as credible. Now, there's interesting research that questions whether tone really matters, but I think the body of evidence suggests that be nice, be authentic, be humble, uh, and be yourself. There's interesting research that suggests, and it's hard to study this well, I understand that, but the research suggests that people don't want a talking head. They want an authentic human being to tell them about the science. And if you do that, you're viewed as more credible. Be creative. And I know a lot of dietitians, dietitians are really good at this, by the way. You guys are really good at this. Be creative in your communication. You use stories, use narratives. Interesting research tells us that if you're creative and you use those kinds of hooks, you can have a real impact. Number 7, point out the gaps in the logic. Research also shows that'll work. Point out the rhetorical devices that are used to push misinformation. If you show people the evidence and you show the rhetorical devices that are used to trick you, it's a conspiracy theory. They're misrepresenting risk. They're just using testimonials. You can have an impact. Yeah, we're not going to change everyone's minds, but we can move the dial just a little bit. And what's number 8? Number 8 is make the correction. Make the correction the thing that people remember. Okay, you don't want to make the misinformation the most memorable part of your message. You want to make the correction. You want to make the fact the most memorable thing. And number 9, I think this is often forgotten. The general public. The general public is your audience. Always remember that. It's tempting, and I fall into this all the time, to get sucked into a discussion with a denier. You're not going to change their minds. You're never going to change the minds of the hardcore deniers, the hardcore conspiracy theorists. So you want to focus on the general public. You can use a ridiculous statement from a denier, conspiracy theorist, as an opportunity to talk to the general public. But always remember, it's the general public is your audience. Don't waste your psychic energy on those hardcore deniers. So those are just some of the strategies that you can use. But remember, I talked about that research that said that about 70% of the misinformation out there comes from individuals just spreading the misinformation. So the other thing that we want to do is we want to encourage people not to spread misinformation, right? We want to encourage people to pause before they share. There's really interesting research. Gordon Pennycook, one of the collaborators on our research project, he's found that most people want to be accurate. They don't have a nefarious goal. The problem is social media is just a frenetic environment. It invites people to share without thinking. So if we can just nudge people to think before they share, right? To think before they share, we can have a real impact. So we've started a campaign. It's called Check Then Share, and please share this. Share this. It's called Check Then Share. We're doing it with our friends at Media Smarts, where we're trying to get people just to pause before they share. And the research tells us if you can do that, you can have a meaningful impact on what information is shared. So I'm going to stop there, and let's see if we have any questions that we could get to on this topic. And again, I really do appreciate this opportunity. One of the things that often comes up, I find, is this backfire question. And people are concerned that if they debunk something, what they're just doing is either they're going to entrench the view, they're just going to highlight it, or they're going to cause people to just to become more entrenched in their personal views. And this is sort of the classic backfire effect. Well, I think it happens. Recent research has shown that it happens rarely, right? And it shouldn't be a reason not to enthusiastically debunk. We want to do it well. We want to use the messaging I just referred to, but it can be. Don't let the concern about backfire frighten you away from debunking. Let's see. I've got a lot of people agreeing. That's a good sign. That's a good sign, right? How to debunk effectively. I think this is a really good, so this is a comment, how to debunk effectively, because I'll often throw out the phrase, debunking works. But I think that this comment is really important. You want to do it effectively. You want to do it constructively. And I think that comes to something else, and something else I always have to remind myself of because I get so worked up about this topic. It's also really important to listen, right? Not everyone has some kind of agenda. Not everyone is trying to sell something. A lot of people are just trying to do the best they can. So listen. Why do people believe these things? Be compassionate. Try to figure out what's going on. What are their concerns? I think it's really important to do that and to remind yourself, especially if you work in this space, to pause and listen. What else do we got here? I love that. I love all the people agreeing. Thank you. So here's one that I think is from a colleague of mine, Jonathan Jerry. He does a great debunker himself from McGill. Uh, do I think that Twitter encourages harsh and mocking? I think it does, and I fall into this to myself. That's why I think you always have to remind yourself to be careful not to allow the aggressive language that's used on spaces like Twitter to create negative language yourself. Now, I want to be really careful here because there are often times when I think snarky comments are completely justified. When Tom Brady, by the way, one of my idols, I got a Tom Brady doll right there. uh, when Tom Brady is marketing something to make money, when he's exploiting the COVID-19 crisis in order to sell unproven supplements, I think it's entirely appropriate to be a little bit snarky about that. When Rush Limbaugh is spreading misinformation, I think it's entirely appropriate. When someone's using the platform to create a brand, to sell, whether you're selling products or ideology, I think it's fine to be a little bit snarky. I think it's worse when you're being snarky to a patient, to someone who's asking questions, to someone who may have fallen for some misinformation. I think it's always best to listen in those contexts. So pick your battle, pick your tone, and you're not always going to get it right. And I don't think that fear of getting it wrong should cause you to shy away. I like to believe, I get it wrong also, but I don't think we should shy away because of that. Let's see. Has anyone ever fallen to BS in my family? The answer is yes. And I'm not going to say which one of my kids. In fact, they're still falling for it. I've got 4 kids. Some of them are really into athletics, and often they do things that's less than efficacious. And I remember early in my life falling for a lot of, I was very involved in athletics myself and falling for a lot of crazy diets. I'm sure you guys hear this all the time, right? So I absolutely think so. Hopefully Patrick Mahone can market. We'll see how Patrick Mahone plays out there. That was a little bit of football call out. So far, he's been pretty impressive. I think what I'll do now is I am going to take this opportunity again as we're wrapping this up to thank you guys for this opportunity. I really appreciate it. Don't hesitate to follow me on Twitter and on Instagram. We can continue these conversations. I'll post some more information about the work we're doing on the kind of messaging that might be beneficial in this space. And I really hope that I get the opportunity to engage with this community again. Dietitians, you guys face this every day, right? You have patients that are and customers and clients that are interested in this. And there's also so much misinformation in the nutrition area. So I know this is something that you deal with, and your work is so important. So I really do appreciate the opportunity. So let's encourage people to check, then share, and I hope to see more of you out there fighting the good fight. So again, thank you very much for this opportunity. Really appreciate it. Go science. Bye for now.